Pawash Priyank, and we're very lucky to have him here. He's better known as Ronnie's father, and so he's going to tell us the story of his experience with stem cell therapies and his son. We'd like to welcome him up to the stage. There he is. A nice warm welcome. And again, please feel free to ask questions at the end, and he's going to give us his story. Welcome. Thank you for being here.
Thank you. Hi everyone. I think many of you have already seen Ronnie yesterday, and he's a very active child. I'm his father, Pawash Priyank, and my son's name is Ronav Kashyap. Everybody calls him Ronnie. He was born on March 9, 2017, and fortunately, we have newborn screening in California, which was really blissful for us. He was diagnosed in the very beginning, like when he was 9 days old. He was diagnosed with SCID. At that point of time, we didn't know that he is X-linked SCID, and in fact, when we heard about SCID, we didn't know what was it. We got a call from our pediatrician saying that Ronnie has been diagnosed with SCID, and it means he doesn't have any immune deficient. He's immune deficient. He doesn't have any immune system in his body. It was really shattering. We didn't know what's going on, what's going to happen, and we thought, probably they would give some kind of vaccination and it would all be cured. But when we looked into it, initially we were just spelling it on Google as saying that SKID, and we really didn't know that it is SCID. Then they gave us the pronunciation saying that it is severe combined immune deficiency, and when we looked it up, the first thing that came out in encyclopedia and Google was it's a bubble boy disease condition in United States. And it was shattering. I mean, I remember long time back seeing a Seinfeld episode where there was a bubble boy condition and everybody goes to visit him. And that was a humorous episode, and I think I laughed a lot in that episode, and I was thinking, is this something really happening to us right now? It was shattering. After that, they asked us to come to the hospital once again, give a little bit of blood more so that they could look it up more, and they could do one more round of testing. And it again came out to be positive. We then got a call. I think it was really, we were blessed to have a call from Dr. Jennifer Puck from UCSF, Benioff Children's Hospital. And she talked to us for almost like an hour. She described what is it, what does SCID mean, and how are we going to treat about it, and what are your next steps to be done. So the call was really shattering. But when we talked to her, we felt like I think they are gonna treat him very well. So he's going to have life. So let's take him to UCSF. So we rushed to UCSF, Benioff Children's Hospital, like within 2 hours. We live in Sacramento, and we came to San Francisco, and then the discussion about the treatment started. To be very honest with you all, in the beginning, it wasn't going very well. We were discussing about bone marrow transplant, because at that point of time, it was not diagnosed that he's X-linked SCID, which had a potential treatment of gene therapy as well. So that time we were discussing about bone marrow transplant, who would be the donor, and would I be the match, would mother be the match, and who would be the perfect match, and everything was just in limbo. So we didn't know what's going to happen. Then after few days, I think like 20 or 28 days, after a month, Dr. Jennifer Puck and Dr. Motkowan came to our room in UCSF and said, even though this entire episode is not very good for you guys, but I have a little bit of good news for you, that he is X-linked SCID, and we could probably do a gene therapy as well. Now, you guys need to understand what is gene therapy, what is difference between gene therapy and bone marrow transplant. So you guys can feel free to do your own research, but we have a consent form which describes entirely about gene therapy, and it might be a very blissful thing for you guys. So we studied about, we already had heard about gene therapy from Paris and London and from other patients, and there was a lot of stuff in Google, and everything good seems to be coming out of it. Like, we were thinking if something would be taken out of Ronnie and treated for the gene in somehow and then given back to him, it wouldn't cause any kind of trouble in his body. But if something would be given from me or from any other donor, it might either overreact him or it might go below the required dose and it might not go well with him. Plus, we were already hearing about graft versus host disease situation and other kind of problems going on with the infections. So we were quite positive in the very beginning when we heard about gene therapy. We were quite positive that we would go forward with gene therapy. We are for sure going to sign the consent, and then we'll discuss what's happening next. So that is what we signed the consent, and June 8, 2017, Ronnie was given the corrected gene. Initially, we placed a port near his heart, and that was only to give him the antibodies every now and then. I think it was given every 20 days or every month to him. He never had any infection. We got him admitted to the hospital before he could have got any infection, so it was quite easy for even doctors to just kind of visit him and go along with the treatment. There was no treatment for any kind of infection. I remember there was a little bit of rhinovirus, which he had cold and cough, but that was very easy. So he had a smooth life of 6 months in the hospital, and on June 8, we did the gene therapy. That was a magical day for us. After that, the inpatient wait started to see his first T cells in his body. So unlike other X-linked test kit, there was one special condition with Ronnie that he had B cell and he had NK cells, but he didn't have any T cell. But obviously there was a talk going on that the B cells and the NK cells that he has probably is not functional as well. So once he gets the T cell after gene therapy, the bad B cells and NK cells, or the non-functional B cells and NK cells, would probably go down, and the functional B cells and NK cells would probably come up. So that is what happened. After June 8, 2017, the desperate wait started for first T cells to be observed in his body, and on September 5th, we received a news saying that he has 5% of working T cells in his body, and I think there is a benchmark before you get discharged from the hospital. So we were waiting for that benchmark. We were quite positive that once the T cells has come up in his body, it will exponentially increase, and I think we can see a good number of T cells in his body. And that is what happened on September 13. On September 13, we heard that he had more than 25% of working T cells in his body, and we were allowed to get out of the hospital. So the only thing that I can say from my bottom of my heart is, we were really fortunate that, first of all, we were in California, which had newborn screening at that point of time, that detected at a very early stage for Ronnie that he was a SCID. The entire episode is not, nobody would, ask for this thing to come into your life. But if it comes, then you need to find out the ways that how blessing in disguise this situation would be for you. So the first thing that blessing in disguise for us was that we were in California. Second thing was we had a call from Dr. Jennifer Puck, who is like, I think she's a godsend lady for us. So, and the third thing was CIRM. Kevin first came to us to meet us and said, you know what, we are funding a clinical trial for gene therapy, and this is something which we are going to do with your baby, and this is how it's going to proceed forward. I think that defined, or that is shaping our life today. We come from India. I'm basically born and brought up in India. Ronnie is born and brought up in Folsom, California. The blessed thing that we have in the United States is, and that is what I want to say in this forum is, there are so many minds across the world who are trying to do the research all the time. But the funds that we have here and the resources that we have here makes the difference. you have so many technologies and you have so many research going on in other parts of the world. But when it comes to the resourcing, when it comes to the funding, and when it comes to actually implementing it, there is nobody. There is no system, there is no government. But when it comes to United States, I think we should really feel blessed that how all the processes come together, and it shapes up the investigation, it shapes up the innovation, and it gets implemented to the patients. And then we collect the data out of all these patients. Recently we had a talk about is the collection of the blood, or is the collection of the blood for the research important? Why is it being collected? So many talks are going on in the government to not get it collected. I don't want to go there, but I think it's really critical for any kind of innovation to have that. Unless you have the data, how are you going to define, or how are you going to shape it for the next patient? So I think it's really critical, and that has really changed our life. Ronnie is doing very, very good today. He has developed sufficient number of B cells, and we have already, now it's been 28 months. Ronnie is 28 months old now, and recently, 3 months back, he got the first set of, so all 3 sets of vaccination, the non-killing vaccination. And he has already, because he was delayed for all the vaccination, he has to catch up. So he is already catching up. He has already completed that. And we are looking forward to live virus vaccinations as well, like measles and smallpox. I think pretty soon he is going to have that as well. Once he has got all of that, and everything in body looks good to him, he's free in the world. He can live his life. He can talk about it. He can inspire other people who have been affected with this. And I think this has been really great. We are really fortunate that we were here, and he got the treatment. We are very close to UCSF. Thank God for that. And he's really doing well. I can't thank more to CIRM for all the foundations that they have laid for these clinical trials. Laid the foundation for all kind of research, provided the funds for the research, which has really helped for patients and patients' parents to see their child grow up in front of them. So I can't be more blessed, and I can't thank more to CIRM and all the research and all the scientists who are working behind it. I think Ronnie is here, so I would like to bring him to the stage, just to have you guys see him once more. So he is Ronnie. I think he's drinking coffee. And he's doing very well. In fact, when he was born, he was 9 pounds, 8 pounds, I think 9 pounds and 20 inches tall. He was really healthy baby. And he is remaining healthy. So, thanks to gene therapy, thanks to stem cell magic that you guys are doing, you guys are studying about it. I think I would let the session continue, otherwise he's going to destroy everything. If you guys have any question for me, let me know. Or any of you can get in touch with CIRM. They have our email address, phone number. Even in future, if you guys are interested to see the progress of Ronnie, you can get in touch with us. That would be we'll be blessed to answer any questions if you have.
It's Bana from SDSU.
Hi.
I just have a question. So you said he never got infection when he was really child, except a very easy one.
Yeah.
So what about now? Is he getting infections or just a normal child disease? And if so, is he healing normally?
Yeah, absolutely. That's a great question, and I think every parents would be curious to know that. Knock on the woods, I would like to tell you one thing, that we are getting cold and cough every now and then, and he gets it, but he gets recovered within like days, like within like 2 or 3 days. In fact, we don't want to talk about it because we would think it would be it wouldn't be good for him. So, but he is really, really doing good. He has been in the parks. He has gone to malls. He has been among other children. He hasn't been to daycare and he hasn't been to school yet, but we are looking forward to that. And he's really, really doing good. He hasn't got any infection of that sort. So just cold and cough. And even, say earlier he was getting IVIG, which was kind of keeping him protected. But now when now when he has got the vaccination and sufficient number of immune system, he's doing good. He hasn't got any infection.
Glad to hear. Thank you.
I'm sorry about that. Ronnie, say hello.
You can leave it. This is your door.
Thank you. Thank you.
Thank you so much.
Thank you.